Nursing for me is doing for patients what they can no longer do for themselves and enabling them to do what they can do for as long as they possibly can.
For me, being a nurse is about doing the little things for people, the simple things that make a difference to them.
It's full of empathy and caring and joyfulness really, and positivity, even at the Princess Alice Hospice here.
I enjoy being very much part of improving or trying to improve the quality of life for somebody.
It's changing your way of thinking to not necessarily getting people well, but getting them to the point where they can the best that they can be.
The patient is part of a family group, and our focus obviously is on the patient themselves, but as part of that group. And when the patient dies, then we continue the support of the family.
It's not just looking after the patient, the individual, it's looking after the whole family, including their animals at times.
It is very humbling that we can also support the children. We have a lot of children's support through our social work team. Just having the playroom has a huge advantage to the children, being able to have a place to escape to go and interact with other children. That makes a difference.
There is no such thing as a typical day at the hospice. Every day is different and the needs change as the shift goes on.
I think having a team structure means that on each shift that we work at the hospice, we have the same patients and therefore we get to know them very well and their families. It's difficult to hand over everything about the family and the patient to a new team. So I think it's more effective and it gives a more holistic opportunity to nurse our patients.
I think working in a hospital, which I did before, you're used to being part of a team. Working here at Princess Alice Hospice, the team is totally different. You're very, very supported by your senior colleagues. You're very, very supported by your colleagues around you, and everybody looks after everybody else.
We look after each other all the time, and we can always go to a colleague, senior, or somebody on the same level as yourself to help you sort out a problem or a question that you've got.
I enjoy my work with my colleagues and particularly the multidisciplinary team here, which is excellent. And we couldn't function unless we worked together, and I enjoy that camaraderie within the team.
There's a lot of laughter on the ward, and sometimes we can be a bit mischievous. There's a lot of laughter and a lot of companionship and friendship amongst the team.
The hospice provides great opportunities for education. We have the unit here so we can do in-house courses, but also we have links with Surrey University and Kingston and St George's Universities. Education is very much encouraged here, and we're always doing courses to keep our mandatory training up to date, to enhance other training that we've done in the past.
The hospice provided me with a placement here whilst I was doing my university return to practice course. So I worked closely with a mentor here, and then they enabled me to work here as a healthcare assistant, learning my way around the place, learning how the procedures go at the hospice. And then once my registration came through, I was progressed on to being a staff nurse.
The environment and the facilities obviously is relatively new. We have a lot to offer staff. We've got a wonderful staff room that we've just opened.
You know, we've got a canteen and a coffee shop, and I've, put on a dress size since I've been here. So we're very well looked after.
The ward is beautifully designed. Every room has its own ensuite bathroom and a view either onto the moat, onto the gardens or onto the courtyard garden. So it's always beautiful for the patients and the relatives to look at.
It's obviously all about meeting families and supporting the families and supporting the patient. And there's a great deal of job satisfaction, which I don't think I could get anywhere else.
This environment, I suppose it's horses for courses. I wouldn't necessarily want to be a surgical nurse wouldn't necessarily want to work in hospice. So part of that is part of me, of what I am or who I am. And working in this environment, I think it's being able to give somebody the best, making the best of their last days, and that I think is really important.
Having worked in IT for 10 years, I could quite easily leave the work at the end of the day and nobody would express a thank you or gratitude or acknowledgement for anything that I'd done throughout the day. Whereas on my very first day here, somebody said thank you, and somebody said, you are making such a difference to our lives. That is my motivation for working here, knowing that I'm making a difference.